Universal healthcare has run into some snags here in the United States legally. However, Washington's Washington Health Trust has learned from both the mistakes and the successes of health programs across the United States. Now, there is a statute called ERISA in the United States. It prevents states and cities from regulating employer-sponsored health plans. And this is a pretty big problem if you want to institute a public option. However, Healthy San Francisco went about this a really creative way that employers could meet the requirement that they were setting by either paying into health plans of their choosing or paying into the city of San Francisco, which funded the public health plan. This was challenged legally, and the challenge was unsuccessful. Whole Washington uses language from Healthy San Francisco's legal successes so that ERISA is not an issue for our plan. Now, Vermont actually successfully passed their universal healthcare plan into law. However, it was passed in 2011, and by 2014, the legislature still had not come up with a way to fund the plan, and so the plan was abandoned. So the primary problem was that Vermont needed to come up with $2 billion additional dollars. But without this funding, Vermont just didn't get there. And so what has Whole Washington done to get around this? We included funding in our plan. Now, does this make our plan harder to pass? Absolutely, it's harder to pass. However, if it is passed, it is much more likely to actually go into implementation and actually help people. If you would like to support Whole Washington and its support for universal healthcare in Washington State, check us out at wholewashington.org.